Good evening. Thank you to the organizing committee for this invitation. When I asked Mr. Google what is the meaning of pearl, he says these are small bits of clinically relevant information based on experience and also on observation. So here are bits and pieces of my humble experiences and observations, and must know, in my opinion, for some derm surgery procedures. Consultation is key. Listen to what the patient wants, but give them what they need. What are the expectations of the patient? Not all patients, but most patients like to know the reason why a procedure will be done on them. Example, a patient comes requesting for a filler in the nasolabial fold to improve this problem area. Some patients are searching the internet before they consult with you, so they will tell you exactly what they want. So patiently, I will explain to the patient that if I inject a filler on the nasolabial fold, it will make her midface much heavier. Then I will suggest injection of filler on the mid-lateral cheek that will replace lost fat volume on this area, and in so doing lift the nasolabial fold at the same time. The patient will then be convinced because this is hitting two birds in one stone. Explain the most appropriate treatment for best results, not only what the patient believes he or she needs. Offer long-term plans of treatment if the treatment cannot be done in 1 or 2 visits, or if the patient has some financial constraint. Try to set priorities. Develop a good doctor-patient relationship. Get the confidence and build the trust of the patient. However, use also your judgment and be able to discern based on your assessment and past history of treatments received by the patient from previous doctors who are the patients who will be very difficult to handle and will never be satisfied with whatever treatment you do. So beware. Knowledge of anatomy is a must. Beauty doesn't come by chance. It comes with correct proportion. And this is the science of beauty. Understanding anatomy and age-related changes will help us assess the aging phase. Be familiar with the rule of thirds. An attractive face and a proportionate face is defined by the rule of thirds. So a ruler will be very handy during assessment. The upper third is from the hairline to the orbital rim. Please do not make the mistake of using the eyebrow as the reference point, because the eyebrow may be lower or higher than the orbital rim, especially with the advent of tattooing or microblading. Middle 1/3 is from the orbital rim to the base of the nose. Lower third is from the base of the nose to the chin. Then the lower third is further subdivided as 1/3 from the subnasal to the upper lip, and then another 2/3 from the lower lip to the chin. On the other hand, it is also good to know the golden ratio for the face, which dates as far back as the ancient Greece. Personally, I find it more difficult to use, using the phi or the phi. The ideal result as defined by the golden ratio, which is roughly 1.6, means a beautiful face is about 1.5 times longer than its width. This is the inverted triangle of youth, which over time, with aging, becomes big square or an upside down triangle. Changes of anatomical components affected by the aging process involve not only the skin, but superficial and deep fat pads, the ligaments, the muscles, and the bones, all contributing to the process of aging. Some studies show that 80% of aging is due to changes in the facial fat pads and the ligaments. The fat pads in the mid-lateral cheek are usually the first to deflate, causing the face to droop over. Studies also show that deep facial fat undergo hypertrophy or shrinkage to almost depletion, while superficial fat undergo hypertrophy, increase in size or augmentation, and consequently ptosis or descent. Ligaments are the shadows left still holding on after depletion and descent of fat pads. There are lots of risks and benefits from doing derm surgery. We should know both to better equip ourselves and take the necessary precautions. Make it as painless and as comfortable as possible for the patient. We hear patients commenting at one time or another that becoming beautiful is painful, not only on the senses, but also on the pocket. So how do we go about it? Of course, topical lidocaine helps. There are times when cold compress alone, especially for sensitive patients, may not be enough, especially if you are in a hurry to get it done with. Change needles as often as possible for procedures that require multiple injections. This may be hard to follow, but ideally, we have to change needle after 5 pokes. Yes, 5 pokes if we want to give the patient a painless experience. How many times should a needle be poked before the patient feels the pain? This is the appearance of a needle before use, after 1 poke, and after 6 pokes under the electron microscope. Touching or scraping with a needle on the bottom of the bottle is equivalent to 12 pokes, so now you know. Brief massaging or tapping the muscle, for example, as a neuromodulator injection, distracts the brain. This explains why the use of vibration tool helps in alleviating the pain.